Our Lisa Sugar talked with Dr. Jody Lenko, the Vice Chair of the Department of Medicine at Lehigh Valley Hospital Hazelton, who provided us with a COVID-19 at-home test video guide and some answers to questions you may have concerning the ongoing pandemic.
This is an example of one of the many FDA-approved at-home COVID-19 tests. Every kit will include everything you need to perform the test successfully at home. This particular box contains 4 individual COVID tests. Once you open up your box, refer to your instructions and make sure you read them from start to finish to make sure you know what's inside your test kit. In general, each test will require a nasal swab and other testing materials. Before opening up any testing materials, make sure to wash your hands and ensure you have a clean, flat working surface. Remember, open up your test swab last, avoiding touching the surface of the tip. You can open up all the other materials and prepare them on your surface. Holding only the stick end of the swab, you can gently insert the foam end into the nostril, approximately 3/4 of an inch. You can estimate this using the tip of your index finger. Firmly and slowly rotate the swab at least 5 times, brushing against the inside walls of the nostril for a total of about 15 seconds. Make sure you swab both nostrils. For small children, we recommend inserting the swab about 1/2 an inch. For this particular test, insert the swab into the tube until the soft pad is in the liquid. Squeeze the tube at the bottom and hold it tight, stirring approximately 10 times. Then remove the swab while squeezing the sides of the tube to extract the liquid from the swab. You can then dispose of the swab. On this particular test, seal the tube with the nozzle cap. The next step involves adding the sample liquid to the test device. Keep the test device flat on its surface. Add 4 drops into the sample well. Each individual test might have different numbers of drops, so please refer to your individual instructions. Set your timer for the amount of time indicated on your instructions. This test kit is read at 20 minutes. They recommend not to read it beyond 30 minutes. At the appropriate time, read your test results. 2 lines indicate a positive COVID test result. If you do have a positive test result, the most important thing to do is to stay home and isolate from others. If you have any further questions about your symptoms or your test result, reach out to your healthcare provider or one of our virtual care options. And that was how to perform an at-home COVID-19 test properly. If you have any further questions, please reach out to your healthcare provider or visit us at lvhn.org.
If the test was positive, we now have antibodies. Do we know how long they last?
So it's a great question. It's very person to person dependent. A lot of it depends on one, were you vaccinated, because you have antibodies from the vaccine. The second question would be how long ago you were vaccinated. You do get antibodies from what we call natural infection, which is being infected and testing positive from the COVID virus. How long that lasts is kind of up for debate. We're still only less than 2 years into this whole pandemic. There is some pretty good research out there that at least from the virus, the strains before Omicron, Delta and the other strains, there was a pretty lengthy amount of time, about 8 months, we think, or longer sometimes, of antibody protection, where patients have tested positive for antibodies after their natural infection. Just so that people are aware, if you get a vaccine, your antibodies will likely be positive in your blood. If you have natural infection, your antibodies will likely be positive in your blood for a certain amount of time, but everyone's different. So it's very hard to tell. But there is at least some evidence that at least a solid 3 months, if not a little bit longer after you've been infected, will you be protected from that particular strain. The question always comes up, if there's a new strain that comes out, there may not be that exact protection to protect you against that new strain.
And what if you were in the middle of your vaccination process? If you've tested positive, is there a certain amount of time we have to wait to either get our second or our booster vaccine?
So specifically for people that did not finish their full vaccination series, we recommend that as soon as you come out of quarantine and as soon as you are feeling well, you finish that vaccination series. If you had your first shot and were waiting for your second shot and became ill. In order to for your booster shot, it's in general about 5 months after your second shot. you can still do the same thing. You can get your booster shot as soon as you are out of quarantine. And if you have any questions about that or how long you should wait, just reach out to your healthcare provider. But there's no need to wait a certain amount of time. The only caveat is if you are one of the few individuals that receive an infusion called the monoclonal antibody infusion. The name of the drug is called sotrovimab. That would be given in a healthcare setting. It's a very small number of people. If you are one of those individuals, you have to wait 90 days after you receive that infusion to get your booster shot.
Today's news feature is brought to you by Lehigh Valley Hospital, Hazleton. Remember, in an emergency, our emergency room is the safest place to be.